Hi Nurse Gainey. You wanted to speak with me?
As a matter of fact, I did.
Okay, what is it?
Well, I hear we are getting another admission who needs to be on rule-out isolation for MRSA. I was wondering why we are putting this emergency room admission in my patient's room who is also on rule-out isolation for MRSA?
Well, Nurse Gainey, let me explain. The emergency room is jam-packed, as is every unit in this hospital. ICU and PCU are completely full. The emergency room is so busy there are patients up against the wall and scattered in the hallway. It is becoming unsafe. We need to push patients out. There are a few more beds available on your unit. I have 2 more admissions coming to your floor. This patient is going to be on rule-out isolation for MRSA, and your patient is already on rule-out isolation for MRSA. It will be a perfect fit. This way we can fit in the other 2 admissions on your unit so they will not have to wait in ER holds or be transferred to another hospital.
Thank you for stating the obvious that my patient is on rule-out isolation for MRSA. This patient also has a strong history of C. diff. Along with PCU and ICU, we here on Med-Surg are also almost completely full. So you are implying that by putting this patient in with my patient, it kills 2 birds with 1 stone, and allows us to get 2 more admissions so we can open up more space in the emergency room? This is what I would call unsafe, not to mention very unsanitary. Let me ask you this.
What is your question?
Well, if you were that ER admission or you were that patient already in the room on rule-out isolation, would you want a roommate who is also on rule-out isolation, for God knows what organism? Would we be doing this if one of the 2 patients was a nurse? I do not think they would put up with this, but because one patient is homeless and the other is from a boarding home, and are probably clueless when it comes to the medical profession, it is okay to do this? What if one patient has MRSA, and the other patient's culture comes back negative? Or worse, what if one patient has MRSA and the other one has VRE? This is against our hospital's policy, but I guess it is okay because nobody ever actually cares enough to read it or do anything. I will speak with my manager in the morning, but by that time, both patients will have been exposed to one another and all the possible germs that will be spread from 11 p.m. to 7:30 a.m. I cannot believe you are allowing this as our supervisor and nurse leader.
Well, I am doing this because I can. I am the nursing supervisor and when I'm here I am the boss. Now if I may, I have an infection control class to attend. Have a good morning.